Please welcome to the stage the Honorable Adrian Dix, BC Minister of Health.
Hi, welcome to Vancouver. It's an honor to be here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh. It was wonderful to be welcomed by Deborah Baker, who, amongst her many responsibilities, is a board member of Vancouver Coastal Health and a real health leader in our community. So thank you, Deborah, for such a welcome to this conference. I have to say that I think, contrary to this discussion of weather, Avis, and every time we see rain these days in the summer, we feel pretty good about it in BC, given that what's happening in our province and in our world with climate change. But I would say that I think this is the best possible place for 1,500 people to gather and enjoy Vancouver and to learn and network together. Now, if someone could just tell that to Lionel Messi. Not sure. I think he's that guy's more likely to own a digital health company than to participate in the conference. But nonetheless, it's all good. I think it's an important time for the conference, an important time for healthcare. This goes without saying. We could have said that 10 years ago. We could have said that 20 years ago. But what we're seeing, I think, in our public healthcare systems is extraordinary change. Some of that change is in the population. Here in British Columbia, we've seen population increases in the last 3 years to our medical services plan of 550,000 people on a previous population of about 5 million people. Population of BC increased by 11% in 3 years. 11% in 3 years. 10 years ago, that number was 3.6% in the 3-year period. And when you combine that with the challenge that we've seen, the public health emergency that is the overdose public health emergency, the public health emergency that it was and is COVID-19, which continues to be with us, this is an extraordinary time. And I think the actions that were taken in that time have broken through some of the barriers to change that public health care has seen for a generation. Just give you a couple of examples. We went in 2 weeks, and you're going to hear from Kathleen Ross in a little while, who one of our great healthcare leaders in BC and now in Canada, and as head of the Doctors of BC and involved in the Doctors of BC that time, we went in a week from 95% in-person appointments to 25% in-person appointments in a week. And that adjustment was made, stabilizing our primary care system and ensuring people still had access to care. In our immunization system in BC, we invested more in digital health than any other province. And the result of that in immunization this past fall, and the significant difference between a province such as BC, which had 2.5 times the level of immunization as the province of Ontario. Isn't that British Columbians are more, I think, positive about immunization than Ontarians? I don't think, in fact, on those questions they're much different. But it became much more easier at the patient level to get immunized in BC because of digital health connections. We have seen significant changes in primary care. BC was 80% fee-for-service province when I became Minister of Health, and 5 years later, it was about 77% fee-for-service billings. And in the last year, we've transformed the primary care system such that 80% of our doctors are not on fee-for-service now. 1 year, 9 months, and 750 more physicians are practicing primary care. These are times of significant and I think even radical change in our system, and this is good news. This tells us that we can move and move quickly. We surely did during the COVID-19 pandemic, and we can surely do that today. And in every one of the strategies that's being put in place, there is a fundamental digital health component, whether it's surgical renewal, whether it's in BC, whether it's diagnostic care, whether it's the approach to mental health and addictions, whether it's anything in our province, we see this transformative change. So this is a moment. I think it's often talked. I remember being a health critic for the official opposition in about 2008, when significant investments were being made, and thank you to Canada Health Infoway for being here. And I think the changes that we will bring in the next 10 years dwarf the changes that were brought in the previous 15 years. The possibilities here, the transformation that is required if we are going to maintain a public healthcare system that is free at the point of use and that ensures a reduction in inequality, will depend on our ability to harness and use digital health in our favor. It is an opportunity for the people in this room and the people beyond it, but mostly it's an opportunity for patients to have more agency over their lives and providers to be able to deliver more health care with less burden and less paperwork. I like fax machines. I was looking for the fax machine table outside. I like fax machines. I really like fax machines. When we first got a fax machine in our office, it was one of the greatest days I think our office had ever seen. But I think the time for that is past us. And we have to do this for patients. I want to say this finally, that I think that often we talk about these issues in terms of health systems. And I encourage you this week, as I know you will, to see it as focusing on individual patients, on the patient in Fort Nelson, who in the last 2 weeks has had to evacuate their hometown, a place that they loved, go to another place, face their highest health stress possible. All of the doctors and the providers had to move with them, and how we can make that person in that context with so much stress in their lives have an ability to access the care that they need in a critical moment without interruption and without difficulty. It is a massive challenge. We have to think of that person and the Indigenous person in Hartley Bay who is distant from the specialized care and needs the support of a system that can come to them and bring care to them and make their lives better and access to care and not get care because the distance between them and that care is too far. We need to reduce those distances. People, especially in rural and remote communities, can benefit most from digital health, and they have not done so to date. But that doesn't mean that can't change. So I want to thank everyone involved in this conference. I want to thank Digital Health Canada for their work. I want to thank Canadian Institute for Health Information for their sponsorship. I want to thank our teams in British Columbia who have been so important in this, and Canada Health Infoway as well. I want to say that we in BC, of course, are making change, and I encourage all of you to pick up, and you're going to hear about this in the next few days from Shannon Malavik and our team, Vice President from Provincial Health Services Authority, our BC Digital Health Strategy, which lays out how we are going to connect digital health and every element of the healthcare system, how we're going to build on that with a patient and provider-centered approach that makes things better for people. I encourage you to pick up a copy at the PHSA table. You see, I got the plug-in, Shannon. I got the plug-in, not the best Minister of Health, but I got the plug-in. I gotta like that. And to all of you, thank you for coming to Vancouver. Thank you for the work you do. This is a moment that we cannot let pass by. It is a crucial moment for healthcare in Canada, and you are a part of it. Let's make this conference a trampoline for more success in the future. Thank you for having me, and welcome to Vancouver.
Please welcome back to the stage our eHealth Conference MC, Avris Favreau.